Your body has an incredible way of communicating with you, often before major health issues arise. From subtle changes in appearance to persistent feelings, your body drops hints that could guide you toward better health. Learning to recognize these and interpret these signs can empower you to take charge of your well-being. In this video, we'll explore 20 health signs that reveal vital insights into your health. Changes in your skin can often be a window into your health. Persistent acne, for example, may be more than just a cosmetic concern. It could indicate hormonal imbalances or high levels of stress. A sudden yellowing of the skin or eyes is a classic sign of jaundice, linking to liver issues. Dry and itchy skin might signal dehydration, allergies, or even underlying thyroid problems. Monitoring your skin regularly can help you spot these potential health concerns early. Similarly, your nails can offer surprising clues about your health. Pitting or small dents in your nails may be linked to psoriasis or autoimmune diseases. Meanwhile, spoon-shaped nails could be a sign of iron deficiency anemia. Brittle nails might indicate a lack of nutrients such as biotin, while thickened or yellow nails are sometimes associated with fungal infections or lung conditions. Your mouth and tongue are also strong indicators of health. Persistent bad breath is often linked to gum disease, while a metallic taste in your mouth might signal kidney problems. The tongue, too, tells a story. A bright red tongue may be a sign of vitamin B12 or iron deficiency, while a white coating could indicate oral thrush or dehydration. Unexplained sores or ulcers that don't heal could even be an early sign of oral cancer. Fatigue is a common complaint, but when it persists without an obvious cause, it's often a sign your body is struggling. Chronic tiredness might point to conditions such as anemia, hypothyroidism, or even undiagnosed diabetes. If fatigue is paired with other symptoms like weight changes or hair loss, it means something may be off. Changes in your weight, whether gaining or losing without trying, can be an important indicator. Unintended weight loss may signal metabolic problems, thyroid disorders, or even cancer. Conversely, unexplained weight gain could be linked to hormonal imbalances, fluid retention from heart or kidney problems, or an underactive thyroid. These shifts mean something may be out of balance. Hair health is another often overlooked sign. Sudden or excessive hair loss can be linked to stress, nutrient deficiencies, or hormonal changes such as those caused by polycystic ovary syndrome, PCOS. Dry or brittle hair might indicate a lack of essential fatty acids or even hypothyroidism. Your digestive system is a key barometer for overall health. Issues like bloating, constipation, or persistent diarrhea can point to food intolerances, irritable bowel syndrome, IBS, or even inflammatory conditions such as Crohn's disease. Dark, tarry stools or blood in the stool are more serious signs, as they may be linked to gastrointestinal bleeding or cancer. Another subtle health clue lies in your eyesight. Blurred vision, difficulty seeing at night, or persistent eye strain might indicate undiagnosed diabetes, particularly if paired with frequent urination or excessive thirst. Dry eyes may sometimes be connected to autoimmune conditions such as Sjogren's syndrome. Your mental health also reveals itself in ways that are worth noting. Persistent anxiety, depression, or irritability can sometimes stem from imbalances in your body, such as vitamin D deficiency, thyroid disorders, or even gut health issues. Research also increasingly links gut bacteria to mood regulation. A sudden shift in your sleep patterns can also be a red flag. If you're sleeping too much yet never feel rested, conditions like sleep apnea, depression, or thyroid issues could be at play. Conversely, chronic insomnia may stem from stress, anxiety, or even early signs of neurodegenerative diseases. Such ongoing disruptions should never be ignored. Before we continue, make sure to subscribe and hit the bell icon for more updates. Let's move on with our video. Pay attention to how often you experience headaches and what triggers them. Chronic headaches may not just be caused by dehydration or screen strain, but can also signal high blood pressure, hormonal fluctuations, or even neurological issues. A sudden, severe headache accompanied by vision changes or nausea may be potentially signaling a stroke or aneurysm. Your hands and feet can provide surprising insights into your circulation and overall health. Cold hands and feet, even in warm environments, could indicate poor circulation, Raynaud's disease, or thyroid dysfunction. Swelling in these extremities might point to heart or kidney problems. Tingling or numbness could even be an early sign of diabetes or nerve-related issues. Persistent ringing in the ears or tinnitus may also signal underlying health issues. While it's often linked to exposure to loud noises, tinnitus can also indicate high blood pressure, ear infections, or even stress-related conditions. In some cases, it might also point to early hearing loss. Your heartbeat is another sign worth tuning into. An irregular heartbeat or palpitations could be caused by stress, caffeine, or dehydration, but might also signal arrhythmias or heart disease. Shortness of breath during routine activities or unexplained chest discomfort indicate heart or lung conditions. Frequent illnesses or infections might suggest an underlying issue with your immune system. If you're constantly catching colds or struggling to recover, it might point to nutritional deficiencies, chronic stress, or even autoimmune conditions. That's why recurrent illness warrants a deeper look. Paying attention to your joints and muscles can also reveal potential health problems. Persistent joint pain or swelling could indicate arthritis or autoimmune conditions, while muscle weakness might suggest nutritional deficiencies or neurological issues. Sudden, sharp pains, particularly in the legs, could even be a sign of a blood clot. Unexplained bruising or prolonged bleeding from minor cuts could point to clotting disorders or even vitamin deficiencies, such as low levels of vitamin K. These signs shouldn't be ignored, as they may signal an issue with your blood's ability to clot properly. Your appetite is another health marker. A sudden loss of appetite can point to infections, hormonal changes, or even early signs of liver or kidney disease. Conversely, an unexplained increase in hunger may indicate metabolic imbalances or diabetes. If these changes persist, they could signal deeper health concerns. Persistent pain in certain areas, such as the lower back or abdomen, often reflects underlying health problems. Lower back pain could be a sign of kidney stones or infections, while abdominal pain might point to gallstones, ulcers, or other digestive issues. Chronic pain is your body's way of signaling that something isn't right. Finally, your sense of thirst can provide valuable insights. If you're constantly thirsty and drinking more than usual, it may be an early symptom of diabetes. On the other hand, a lack of thirst could indicate adrenal insufficiency or dehydration. Balancing fluid intake is essential for maintaining health. Your body is constantly giving you clues about its well-being. These 20 signs serve as a guide to understanding what your body is trying to communicate. While some symptoms might be benign or temporary, others warrant medical attention. Listening to these signs and addressing them promptly can help you maintain optimal health and catch potential problems early.